alaikum. My dear students, I am Dr. Sagia Afrose, Associate Professor, Department of Pharmacology, Bashundhara Ad-din Medical College. Today I am going to discuss about anti-Helminthic drugs. At first, I have to discuss about the classification of the anti-Helminthic drug. What are the anti-Helminthic drugs? For roundworm or for Ascaris lumbricoides, mebendazole, albendazole, PYRANTEL, PAMOATE, Ivermectin, etc. For hookworm or Ankylostoma duodenale and Necator americana, the drugs are mebendazole, albendazole, PYRANTEL, PAMOATE, etc. For threadworm or Enterobius vermicularis, the drugs are PYRANTEL, PAMOATE, mebendazole, albendazole, piperazine. And for strongyloidosis stercoralis, the drugs are Ivermectin, albendazole. For whipworm or Trichuris trichuria, the drugs are mebendazole, albendazole, etc. For filariasis or Wuchereria bancrofti or Brucea melai, the drugs are Diethylcarbamazine, Ivermectin, and albendazole. And for tapeworm or Taenia saginata, Taenia solium, etc., the drugs are Praziquantel, Niclosemide, albendazole, etc. And for hydatid disease caused by Echinococcus granulosus and Echinococcus multicularis, the drugs are albendazole and mebendazole. Now I am going to discuss about the drug that is commonly used in the anti-Helminthic as a anti-Helminthic drug, that is albendazole. At first, I am going to discuss about the mechanism of action of albendazole. Albendazole acts by inhibiting the synthesis of microtubules in the parasite and also block the glucose uptake by the nematodes and decrease the ATP synthesis required for the survival of the nematodes and decrease the energy supply. Parasites are immobilized and slowly die and expel out from the intestine through the feces. What are the uses of albendazole? The uses of albendazole are ascariasis, trichuriasis, hookworm infestation, pinworm infection, hydatid disease, neurocysticercosis, and cutaneous and visceral larva migrans. What are the adverse effects of albendazole? The short-term therapy, the infrequent adverse effects are nausea, vomiting, abdominal pain and diarrhea, and the rare effects are hypersensitivity reaction, rash, urticaria, agranulocytosis, alopecia, elevation of the liver enzyme and teratogenic effects. The short course therapy, that is done by 1 to 3 days for nematodal infestation, the adverse effects are mild and transient, that are headache and nausea, and the treatment of hydatid disease. The treatment is persist for 3 months. The adverse effects are hepatotoxicity, agranulocytosis, and pancytopenia. The treatment of neurocysticercosis is associated with inflammatory response to dying parasite in the central nervous system, including the headache, vomiting, fever, and seizure. What are the contraindications of albendazole? The contraindications are pregnancy, that is pregnant lady, children under 2 years, and known hypersensitivity reaction of that drug. Now I am going to tell about the Praziquantel. What is the mechanism of action of Praziquantel drug? It increases the permeability of the trematode and cystode cell membrane to calcium and resulting in paralysis, dislodgement and death of the parasite. It is effective against the adult worm and immature stage of the larva. It should be taken with food and rapidly absorbed after oral absorption. It is distributed into the CSF and the common adverse effects are dizziness, malaise, headache, GIT upset, such as nausea, vomiting, abdominal discomfort, cramp, etc. What are the uses? The agent of choice for treatment of all form of schistosomiasis, and cystoid infections such as teniasis, diphyllobothriasis, and treatment of neurocystisarcosis caused by Tinea solium. Hydatid disease is another indication of this drug, and other trematode infection also treated by this drug. What are the adverse effects of Praziquantel? The most common adverse effects are headache, dizziness, drowsiness, lassitude, nausea, vomiting, abdominal pain, loose stool, urticaria, arthralgia, myalgia, and low-grade fever. And sometimes there may be elevation of the liver enzyme. The low-grade fever, pruritus, skin rash, sometimes associated with the worsened eosinophilia and probably due to release of protein from the dying worm rather than direct drug toxicity. So that in neurocystisarcosis, the neurologic abnormalities may be exacerbated by the inflammatory reaction around the dying parasites, and patients who do not receive corticosteroid usually presenting headache, nausea, vomiting, mental changes, and seizures. More serious reaction including the hyperthermia and intracranial hypertension. Corticosteroids are commonly used with the Praziquantel in treatment of the neurocystisarcosis to decrease the inflammatory response. What are the contraindications? The treatment of ocular cystisarcosis, because due to destruction of the organism in the eye may causes the irreversible visual damage, and children under 4 years and pregnant lady. Niclosemide are another important anti-Helminthic drug that inhibit the mitochondrial oxidative phosphorylation of the parasite, and adult worms are rapidly killed by this drug. What are the uses? Uses are for the treatment of teniasis, diphyllobothriasis, second line drug for tapeworm infection and intestinal fluke-like infection. Diethylcarbamazine, it is the drug of choice for Wuchereria bancrofti or filariasis. It is rapidly absorbed after oral absorption, and diethylcarbamazine immobilize the microfilari and alter their surface area and displacing them from the tissue and making them more susceptible to the destruction by host defense mechanism. It kills the microfilari. The mode of action against the adult worm is unknown. What are the uses? The drug of choice for filariasis caused by infection with the Wuchereria bancrofti and Brugia malai, Brugia timori, and Loa. The diethylcarbamazine and albendazole may be used as preventive therapy for this disease. What are the adverse effects? Adverse effects are fever, anorexia, weakness, nausea, vomiting, arthralgia, headache, dizziness, malaise, urticaria, cough, chest pain, asthmatic attacks, etc. Adverse effects also occur as a result of release of protein from the dying microfilari or adult worm. The reaction to dying microfilari are usually mild in Wuchereria bancrofti and more intense in Brugia malai and severe in Loa infection. Reactions include fever, malaise, papular rash, headache, gastrointestinal irritation, cough, chest pain, muscle or joint pain. The symptoms are occur in patients with heavily loaded of microfilari. Antihistamines are given in first few days of the therapy to limit the allergic reaction, and corticosteroid should be started and dose of diethylcarbamazine lowered or interrupted if the severe reaction occur. Now, the Ivermectin, it is the drug of choice for strongyloidosis, onchocercosis, and this drug kills the microfilari but not active against the adult worm. The patient with microfilari in the cornea or anterior chamber may be treated with the corticosteroid to avoid the inflammatory eye reaction. What are the mechanism of action? Ivermectin appears to paralyze the nematodes by interfering their GABA-gated chloride channel, and chloride influx is enhanced. Therefore, hyperpolarization occur and resulting in paralysis and death of the worm. What are the adverse effects? Fatigue, nausea, vomiting, abdominal pain and skin rashes, fever, headache, dizziness, somnolence, weakness, rash, pruritus, diarrhea, joint and muscle pain, hypotension, tachycardia, lymphadenitis and peripheral edema may occur. Antihistamines or steroid may be given to resolve the symptoms. Now the PYRANTEL PAMOATE. PYRANTEL PAMOATE is a broad spectrum anti-helminthic drug. It is highly effective for treatment of pinworm and ascariasis. What are their adverse effects? Nausea, vomiting, diarrhea, abdominal cramp, dizziness, drowsiness, headache, insomnia, rash, fever and weakness. And there may be sometimes elevation of the aminotransferase enzyme in liver. What are their contraindications? The patients with liver dysfunction, pregnant women and children under 2 years are avoided for giving this drug. Thank you all. Thanks for today. In next class we will discuss about another topics.